Hello, this is Lynn. Down here today, I am presenting some information for you. And I want to keep it casual, but I figured that it would be a lot easier to present if I did it in a PowerPoint presentation. Now, if you've been watching my channel for a while, you will know that I have mast cell activation syndrome. And because of that, even on the carnivore diet, I've been needing to watch histamine levels in my food. And I've also learned, since I got diagnosed with mast cell activation syndrome last year in 2022, I have learned that it is way more common. Now, the National Institute of Health classifies it as rare, but it's not rare. The leading experts on the condition say that it's not rare. It's potentially up to 1 in 6 people may have it. So I know that with the carnivore diet, the vast majority of people do amazing on it. But even with the people who do well, they have found that there's certain foods, certain carnivore, classified as carnivore foods, that they can't eat. They find out that it makes them feel worse. So I'm hoping that this will shed some light on possibly why that might be the case. So this video is called Carnivore Diet Low Histamine Approach for those with mast cell activation syndrome or histamine intolerance. If you think that you might have an issue with histamine, stick around and let's go through this material together. Okay, I do have to give you a disclaimer because I am a registered nurse. I have a bachelor's degree in nursing. I have recently retired February of 2023 because of my mast cell activation syndrome. So because I'm presenting some information, I'm just going to read this to you and then we will move on. So my disclaimer is, although I am a nurse by profession, I am not your nurse. All content and information in this video is for informational and educational purposes only. It does not constitute medical advice and does not establish any patient-nurse relationship by your viewing of this video or any other content on my YouTube channel, Midlife Carnivore. Although I strive to provide accurate general information, the information presented here is not a substitute for any kind of professional advice, and you should not rely solely on this information. Always consult a professional in the area of your particular needs and circumstances prior to making any medical decisions. Okay, so let's move on. So, what is histamine intolerance? So, it's not actually a sensitivity to histamine itself. If that was the case, people with histamine intolerance would be reacting all the time because our bodies are releasing histamine from our mast cells frequently. It's just part of our natural immune system. But what it is, it's an indication that you've developed too much of it. Histamine is an important thing that we need in our body. It sends messages to the brain. It triggers the release of stomach acid so that you can digest your food. It's also released after an injury or an allergic reaction as part of the immune system. So, but when there's too much histamine, or it can't break down properly, it can affect your regular bodily functions. And we do have an enzyme that breaks it down. So we're going to talk a little bit more about that later. Okay, so in order to really understand histamine, like my allergist told me about this bucket analogy, and you may have heard this before, but your histamine bucket is basically your personal capacity to handle histamine and other sources of inflammation. Now, the size of your bucket is genetically determined. Some people have a really tiny little bucket and other people have a really, really large bucket. And so the size of your bucket, you can't control. Sometimes what goes into your bucket, you can't necessarily control. Because, for example, you may experience problems with not just foods, but hormones, the environment, the weather, there's some medications, even stress can fill up your histamine bucket. And, you can have a medication that blocks the enzyme that breaks down histamine, which is called diamine oxidase. So there's all these factors that can go into filling up your histamine bucket. And the key with this bucket is that until the bucket is full and overflowing, you may not have any symptoms. You may feel just fine. But then it just takes one little thing and suddenly you're having a reaction. And it's like an allergic reaction. For me, it's a mast cell reaction, but it's very similar to an allergic reaction. And I'm going to go over what that looks like. You could even have a history of mold exposure, birth control. There's all sorts of things that can actually fill up your histamine bucket. The only way that I'm aware of to get that bucket, the level in the bucket down, is to avoid the triggers of histamine release. So for me, with my mast cell activation syndrome, I avoid high histamine foods. I avoid excessive temperature fluctuations, try to stay out of heat, and especially if it's prolonged exposure to heat or if it's really stuffy, I will tend to have a mast cell reaction. But there's certain things I can't control. For example, the weather, when barometric pressure changes occur, I can have a reaction. Now, whether or not I have a reaction may be a factor of how full my histamine bucket is. Now, I take antihistamines. I also take something called DHist, which has a combination of supplements that will actually inhibit the release of my mast cell degranulation. So there's a whole bunch of different options and things that I do to help myself. But if you keep this histamine bucket analogy in mind, it explains why a lot of times, unless you have a really severe allergy, so for example, somebody who has a peanut allergy, they can just experience a really severe like anaphylactic type reaction just with a very, very little exposure to peanuts. They probably have a tiny itty bitty little thimble-sized bucket for peanuts. That's not the case with me, and that's not the case with most people. So it can get really confusing and hard to figure out what you're reacting to when sometimes you react, other times you don't. Also, the severity of reactions varies. It's not always an instant reaction, like the person with a peanut allergy that gets anaphylaxis quickly. Sometimes the reactions are days later, so you never really know. It's hard to know, but there is a way of figuring out a lot of it. So we're going to go over that. Okay, now let's review the symptoms of histamine intolerance. The most common set of symptoms with histamine intolerance are the GI symptoms. Now, again, it's really important as you go over this list. If you look and you see, oh yeah, I've got a bunch of these symptoms, it's really important to do not self-diagnose. Make sure you work with your doctor because there may be something else causing those symptoms. It's important to rule out other causes. And I just want to share with you like my experience as a nurse when it comes to this issue. Hang on, I need to turn a little bit more light on here. There we go. Hopefully that's better. I would talk to patients who would come, I worked in gastroenterology for the last 8 years of my nursing career. And I would talk to patients who would say, they'd see the doctor and say, for example, they had abdominal pain. And the doctor ran a few tests and they got a letter. You get this form letter in the mail that says your test came back normal. And most often they'll say, if you're still having symptoms, call the office because they want a follow-up appointment. And honestly, if you've gotten to the point where you're being referred to a gastroenterologist, the likelihood is that you still have symptoms. But so many people that I talk to say, oh, yeah, I went to see my gastroenterologist and everything came back normal and they couldn't figure out what was wrong, or they said nothing was wrong with me. And honestly, that, in my opinion, and although I love the doctors I work with, they don't always communicate very well that there's a treatment plan, or not treatment plan, but an investigation is in stages. They will always order the most common tests first, because the important thing is to rule out the most common reasons for your symptoms. But that's just stage one to the investigation. If all of those tests come back normal and you're still suffering, they're not done. The intent is that they're going to order the next stage of tests. Now, they're not going to order everything at once because your insurance isn't going to cover that. Your insurance company wants to see that the doctor has ordered the most common set of tests first, and if nothing is found and you're still suffering, then they'll approve a further workup. And I've dealt with a lot of patients who it takes, maybe 3 or 4 sets of tests before they finally figure out what's going on. So don't make the assumption that the doctor's done with you and has ruled out everything. It's just the first step to an investigation that may take many steps. And just because, say, for example, the gastroenterologist may not find anything, doesn't mean another specialist doesn't need to get involved. Here's a good example. Say, for example, you go see your primary doctor and you have your, say, maybe annual blood work, and it shows that you're anemic. Your primary doctor, in all likelihood, is going to start with a referral to the gastroenterologist. And the gastroenterologist is going to look for a source of bleeding, a GI source of bleeding. So they're going to do a colonoscopy, an upper endoscopy as well. If those don't show anything, because the scopes can only reach so far, they're going to do something called a capsule endoscopy, where you swallow a capsule that has a camera and it's going to take a video going all through your GI tract and look for a source of bleeding. Now, if the doctor doesn't find anything, you're going to get that letter saying everything came back normal and there was no source of bleeding. Again, that doesn't mean that they're done, because the next step would be to refer you to hematology, so the hematologist could go ahead and do their workup and see if they can figure out why you're anemic. So when I say make sure that you see the doctor and rule out other causes, make sure, ask your doctor, have you ruled out any other cause for my symptoms? Are you done with the investigation? Do I need to see another specialist? Make sure that you confirm that they really are baffled and they don't know before you jump to the conclusion that the doctor just doesn't know what's wrong with you. So anyways, I needed to make sure I explain that, because that's so important that you see the process through and get the workup in the investigation of your symptoms that you need, and don't just assume that the doctor's done with you. Okay, so with that said, GI symptoms are the most common symptoms of histamine intolerance. So you could have digestive issues like indigestion, heartburn, abdominal pain, bloating, diarrhea, constipation, gas, nausea, vomiting. So you can also have some other symptoms like headaches, migraines, some nasal congestion, sinus issues, fatigue, itchy skin, hives, irregular menstrual cycle. In more severe cases, you can have severe abdominal cramping. I found the abdominal cramping to be actually severe. Tissue swelling. So like, for example, my throat swells. I have swelling of my hands and feet when it gets too warm out. High blood pressure, irregular heart rate. So like tachycardia, like I would have heart palpitations. You could have anxiety, difficulty regulating your body temperature. So you go from being too warm to too cold, dizziness. Now, when I look at this list, I've experienced everything on this list except for maybe constipation. But then I have mast cell activation syndrome. So it doesn't mean that you're going to experience everything on this list. But a lot of people, there was a study done in 2019 where it found that on average, people had an average of 11 of these symptoms. And almost 97% of people in this study had at least 3 of the symptoms. So if you are having multiple of these symptoms, see your doctor. And this presentation might be helpful for you with the carnivore diet or your diet in general if you have a problem with histamine. So I wanted to go over mast cell activation syndrome as well because it's a little different than histamine intolerance. Mast cells are part of your immune system. Everybody has them. They work for you, and when they work properly, they serve you because they alert your immune system to react to pathogens. My mast cells are not behaving properly, so I have mast cell activation syndrome. And mast cells, they whenever they're exposed to something that that alerts them that something that's wrong, they release over 200 different chemical mediators. Histamine is one of them, and histamine is the most common one. But with mast cell activation syndrome, it can have head to toe symptoms. It can have brain symptoms. I hope you can see all this, but a lot of these are crossovers with the histamine intolerance. But you can have brain fog, cognitive dysfunction, anxiety, depression, headaches. You can have a bunch of ear, nose, and throat issues, including, wheezing, shortness of breath, your throat, swelling, which my throat does. All the GI issues are there. You can have bone and muscle pain, which I have experienced before the carnivore diet. You can get osteoporosis. You can get all sorts of issues with your bones. You can have skin issues, flushing of the face, neck, skin, hives, skin rashes, itching with or without a rash. I have rosacea. If you watch my channel, you know that. And I've had flushing issues a lot. Cardiovascular, you can be lightheaded, you can faint. I've never fainted, but I do get lightheaded. You can have a rapid heart rate, which I have definitely had tachycardia. I've had heart palpitations, which have all resolved with the carnivore diet. You can have chest pain, low blood pressure, or high blood pressure, with the start of a reaction. Your blood pressure is going to be high, or your blood pressure can be unstable, meaning it wants to go up and down. You can have female problems. You can have uterine cramps, bleeding, which absolutely I've had. You can have urinary issues, bladder irritability, frequent voiding. Absolutely, I have that. And you could even have anaphylaxis and angioedema, which is generalized swelling. The symptoms are sudden, unpredictable. So if you've seen, like myself, I saw over the course of the years like 17 different specialists. They couldn't find anything wrong with me. It took years to get a diagnosis of mast cell activation syndrome, but I wanted to at least go over these symptoms because, again, the leading experts in mast cell activation syndrome say possibly up to 1 in 6 people have it. So I want you to be aware of what the symptoms are, so that you can at least be aware that this condition exists and is way more common than we thought. And if you're frustrated because you can't get a diagnosis and you're having a lot of these symptoms, then see an allergist. See if you can get a workup for mast cell activation syndrome. And again, it took me 6 years to get a diagnosis. Doesn't always take that long, but it can take a while to get a diagnosis. Okay, so I'm going to go over this list. It's a food compatibility list about histamine, and it is put out by the Swiss Interest Group for Histamine Intolerance. One of the things that's really important to know about this list is that, well, first of all, about any histamine food list, is that it is very, very, very subjective. There is no test to test for the histamine levels in food, and it changes because it has to do with the freshness of the food as well as some other factors. So any food list that you look at is going to be based on people's perception of how the food impacts them, whether they have a reaction to the food. This list is no exception to that rule. I have chosen this list to go by for myself because I'm part of a couple Facebook groups. One of them is for my mast cell activation syndrome, and one of them is for my hereditary alpha tryptophanemia, which is the other related condition that I have that's hereditary, it's genetic. And so the people in this group, And the group, the mast cell activation syndrome group, is actually sponsored by the Mast Cell Society. So it's not just a bunch of people with mast cell activation syndrome coming together that don't really know anything. It's actually the society with the experts that have this Facebook group. They have said that this list is, in their opinion, the most accurate. And they've found that it's the best, and it's very, very comprehensive. So I'm going to be going over this list, and I'm going to be focusing on carnivore. This is a long list, and it includes all the food categories. So if you happen to be watching this video interested in food, high histamine foods, and you're not doing the carnivore diet, I will have a link in the description. You can pull up this list and take a look at it, print it out, use it for yourself. That is after you've seen your doctor. I mean, it's not going to hurt you to avoid high histamine foods. So I don't want to say that, you can't consider, some dietary modifications until you've seen your doctor, but I just don't want to even give the remote assumption that I'm saying do that instead of seeing your doctor. Definitely see your doctor. Okay. So the food list has a compatibility scale, and it has mechanisms affecting histamine metabolism. So I wanted to go over these with you before we go into some of the specifics about the food list. So the compatibility scale, again, these are a subjective rating from the people whose input went into making this list. So if it is rated a 0, it means it's well tolerated. People had no symptoms expected. No symptoms were expected at eating a normal amount of this food. So 0 means the people, they didn't have any reaction. Again, immediate reaction or delayed reaction, which can be several days. 1 is that it's moderately compatible. It had minor symptoms. Occasional consumption of small quantities is often tolerated. So people found that if I eat a little bit, I tend to do better than if I eat more. Okay, and so number 2, a score of 2 is that it is incompatible with somebody with histamine intolerance or mast cell activation syndrome. And honestly, this can go for people with systemic mastocytosis as well. Significant symptoms at a normal intake level. So you eat a normal portion and you develop significant symptoms. And then 3 is poorly tolerated and you get severe symptoms just by eating some. That would be an example of a peanut allergy, but it may be that you get severe abdominal cramping. It may be that you get diarrhea. You might get a really severe headache. I found for me when I was eating things in the 3 category, it didn't take that long. One of them for me is kiwi. I can eat kiwi and probably within an hour or 2, I can be like doubled over with abdominal cramping. I don't eat kiwi anymore because I'm on the carnivore diet. So I'm not going to worry about the little dash and the question mark because none of those apply to the foods I'm going to be reviewing. And then there's mechanisms affecting histamine metabolism. So HI means it's highly perishable. A lot of the meats are like that. Fish can be like that. And so it basically means that really, really fresh, it may be fine, but quickly it starts to form histamine. And the freshness and the shelf life of things are really important. How you store the food is really important. So that's highly perishable as an HI. H is high histamine content, and this is what's very subjective. It's based on what they're saying that it has perceived high histamine content. And A means other biogenic amines. So what that means is their histamine is only one of the chemicals that this what's called DAO, the enzyme breaks down. It actually prefers these other amines. So what happens is that if this particular food has other biologic amines in it, your enzyme is going to start with digesting those substances, breaking down those substances, and there will be a delay in breaking down the histamine. And so that means histamine is going to be hanging out in your body longer, and you're filling your bucket up longer before it can be broken down by the diamine oxidase. And then L is the liberator of mast cell mediator. So it's a histamine liberator. Basically, what that means is that the food will cause your mast cells to degranulate and expel histamine into your body. And then blocker means that it actually blocks the enzyme, the diamine oxidase, and other histamine degrading enzymes. So you don't want to block the enzymes that actually break the histamine down in your body. Okay, so that's what that means. Hope everyone's following along. I'm hoping the presentation here is clear. Alrighty. So what I've done is, again, I'm going to stick with the carnivore foods. I'm not going into vegetables, not going into fruits, not going into grains, because carnivores don't eat that. So I'm going to show you a bunch of examples, and the pictures I have in these slides are not everything. I just grabbed a couple of pictures just to show you some examples. So carnivore foods that are scoring 0, meaning that people did not really report any reactions, is fresh beef. And again, the freshness of it makes a difference. Some of these are hard to control. But what you can do as soon as you get home from the grocery store is put it in the freezer. Some people are really, really sensitive to the freshness of food, to the point where, for example, if you make something with meat and you have leftovers, they have to actually put the leftovers in the freezer and then defrost them when they want to eat them again. I'm not that sensitive. I can have something stored in my refrigerator for a day or two, and I just need to make sure I eat it within a day or so. But poultry, fish, note freshly caught or quick frozen. So the fish that's called fresh in your grocery store, where you go to the butcher counter and it's got all these fresh meats, no, that's not fresh fish, because it's been sitting there. Even though it's been chilled, fish actually forms histamine quickly, and so that is not fresh fish from a histamine standpoint. Most people do fine with it, but if you have a histamine problem, that may cause an issue with you. Egg yolks are a problem. Sorry, not a problem. Egg yolks are fine. Sweet cream butter is fine. Now make sure on the package it says sweet cream. Farmer's cheese, which I happen to not like. Young Gouda, emphasis here on young, and some of the packaging will say JUNG or JONG if it's from I think it's a Dutch cheese. I think that's the language there. Not aged. Aged cheeses are a problem. Mozzarella is fine as well. So carnivore foods scoring 1. Here are some examples. So meaning that you may be okay with it at normal quantities. You might have a reaction if you eat a little more. Pork. So fresh is really important. Untreated is important. So just if you get a pork roast, it's fresh, you cook it, you eat it, you may do fine. But the HI there means that it will fairly quickly start to build up histamine if it's left and not eaten. Fresh game is fine. It's perceived to have a little more histamine. Cultured butter. Now, honestly, I had not looked at this list since before I started the carnivore diet. And so I forgot that this was a problem, or a potential problem. Now, a score of 1 is not a big deal, but I eat a little bit more butter than most people do. And so cultured butter is different than the previous slide, which says sweet cream butter. So what I have learned is that often cultured butter, it doesn't always say cultured butter on it, but often it's the premium butters, like in the European butters. Now, the one I have here as an example is from a Vermont creamery. I put it there as an example because it actually says cultured butter. You'll notice too with cheeses, and this is something that I learned, is that a lot of cheeses are made with cultured milk. So really watch for that word cultured. But stick with sweet cream butter and you should be okay. And you can try the cultured butter. You may do fine. But you may need to limit the quantity of it potentially. Again, it's all subjective. Pay attention to your body. Feta cheese has those other amines that could delay the breakdown of histamine. I put an example here of the grass-fed, the ghee, which you would think, oh my gosh, that's like really super healthy. And for most people, yes, it is, but it is cultured. So it potentially could cause an issue for you if you have histamine intolerance or mast cell activation syndrome. Okay, so carnivore food scoring, a 2. So meat, entrails, and innards, I know entrails is an issue, like their casing. A lot of times there's a casing on sausages. Innards, I'm assuming this is organ meat. This is the one thing, and if you know the answer to that, please let me know in the comments. I'm assuming it's organ meat, but I'm not 100% sure on that. I need to research that one more. Shellfish is a 2, meaning and it's generally incompatible with a histamine problem. Egg whites. All right, so when you're eating eggs, and if you've had problems with eggs, or if you've had problems with egg, it may be the egg whites that's the problem. The exception to that is quail eggs. Quail eggs, which I have no idea where to get, but quail eggs are okay. The whole egg is fine with a quail egg. I'm going to have to figure out how to get quail eggs because I love eggs, but I have found for me, I can eat a little bit of egg, but if I eat too many eggs, I am feeling it. I'm having issues usually with throat swelling. Blue cheese is sad, but that's a problem, can be a problem. And that kind of falls under the same category of molded cheese, but any aged or molded cheese could be a problem. And I was so sad to find out cheddar cheese is one of those that could be a problem as well. I looked at my package and I've been focusing a lot on eating cheddar cheese. And since putting together this presentation, I was in shock going, oh my gosh, that may be why I'm still having reactions, because I'm eating cheddar cheese. I looked at the package of my cheddar cheese and the first ingredient was cultured pasteurized milk. And so now I know, okay, it's the cultured pasteurized milk that is probably the problem with the cheddar cheese. Now, when it comes to aged cheese, I did a little research. And so for example, on the previous slide where it said young Gouda, technically aged for up to 1 month is considered young. But I think it was 1 month. Let me go back here. Okay, I can't go back. Anyways, I think it's 1 month, 4 weeks was considered young, but I think up to 8 weeks you're okay. Okay, so products made with unprocessed raw milk. So raw milk is really healthy, but if you have a histamine problem, a mast cell problem, probably better to avoid it. Okay, and here is what breaks my heart. Carnivore food scoring a 3, and you can see bacon. That's what really breaks my heart. In fact, most of these break my heart. These are things that are completely incompatible with somebody with histamine intolerance or mast cell activation syndrome. So again, dried or aged meat or fish. So dried meat is like jerky, right? Aged meat, fish. So those wonderful aged steaks may be a problem. So anything smoked, which is unbelievably good, like smoked salmon. Nope, that's incompatible. And of course, there's bacon, salami, sausage, tuna. So you get the cans of tuna and think that's really healthy, but if you have a histamine problem, then it's incompatible with your body. It's perceived to be incompatible. I'm going to go over how to test that. And then hard and aged cheeses. So for example, hard cheeses are like Parmesan, Romano, aged cheeses are like the aged like Gouda, the Gruyere, provolone, cheddar, the cheeses that were aged more than like 4 weeks or so, like from 4 to 8 weeks was okay. So sad I can't have Parmesan. Anyways, I know it kind of sucks a little bit of the joy out of the carnivore life. But then again, if I don't feel good when I eat them, it's only temporary satisfaction when I eat it, and then I suffer. So it's better to know that this is an issue for me than not. That was my phone. Okay, and because a lot of people who are on the carnivore diet do allow some sweeteners, maybe drink tea. I put some non-carnivore, zero carb foods. Now, lard is not non-carnivore, so that is a carnivore food. But these are also some foods that are rated 0. So sweeteners, stevia, which I happen to not really like. Xylitol, I have a warning here, it can be deadly to dogs. We actually had our dog Max got into my purse, this was years ago, ate a whole package of sugar-free gum, because xylitol is the sweetener put in sugar-free gum. I caught him on my bed finishing off this package of gum. And this was a long time ago, and I didn't know at the time, but I quickly looked up xylitol in dogs and found out that xylitol can cause a deadly drop in blood sugar. So we rushed him to the vet. The vet said it was good because most people wait until it's too late. Dog starts to have symptoms and then it's too late. So he got a good overnight stay and had to get glucose injections and swallowing charcoal, and he was okay. He ended up okay. $700 later. So xylitol, I'm always really wary. I make sure that I put a warning on there. Be careful if you've got dogs. Now monk fruit drops is not listed on this particular food list. I looked it up because I like using monk fruit drops, and I added it here because of that. Because it actually inhibits histamine release from the mast cells. And because I have mast cell activation syndrome and my mast cells like to release histamine, anything that will inhibit that, I'm all for. And I tried to drink black coffee and I haven't weaned myself off coffee. Maybe someday I will. But for now, I am drinking coffee still. I drink buttered coffee. I do add some monk drops to my coffee. I'm very happy to know that they actually work in favor of my condition. Mineral water, tap water. Tap water is an interesting one. I have found that many times I cannot drink filtered water. And I feel so much better drinking tap water. This may be why. I don't know. The filtered waters can be higher in histamine. And then the teas are chamomile, rooibos tea, peppermint sage, and verbena teas. I don't drink a whole lot of tea, but okay. So now here are some commonly used items to avoid, and I know one of these is going to be a shock to you, but iodized salt is incompatible if you have histamine intolerance. Now I use the Redmond sea salt, but if you used iodized salt and you're having some symptoms of histamine intolerance, it might be the salt. Now, I have listened to plenty of carnivore doctors say supplement with iodine. And before I reviewed this list again, I got some drops with iodine and I was having reactions. I'm like, oh my gosh, I was adding it to my water and with my element, and I kept having problems. Like I felt like my throat was swelling, and I was having just generally not feeling well, and I think it was the iodine supplement. So I have not been able to take that anymore. Anything with yellow dyes, hopefully you're not eating anything with dyes, but just so you know, yellow dyes are worse than the others. Alcohol, depending on the alcohol, can be either a 2 or a 3. All vinegars other than distilled white vinegar is a 3, incompatible. Soy sauce, incompatible. Seaweed, algae, citrus. So if you're squirting a little lemon or lime, which is very few calories, just to add some flavor and you're having problems, potentially that could be an issue. Fermented foods. So if you're not quite 100% carnivore and you're like having some sauerkraut with your, or eat a pickle every once in a while, fermented foods could be an issue for you. Okay, so this slide is going over how to use the histamine food list. This list is intended to be used as part of an elimination diet. If you follow just along with like the 0 score foods, it is pretty restrictive. The goal is not to be the most restrictive with your diet as you can be, but the goal is to identify which of the foods cause problems for you. And everyone is individual, everyone is different. How one person reacts is not necessarily going to be how another person reacts. So the goal is to figure out, what do you react to? So the way to use this list is to start with the foods that have a score of 0 and stick with those foods for about 4 to 6 weeks exclusively. Hopefully, when you're doing that, whatever symptoms you have will resolve and you'll feel really good. And that's a really good indication right there that you were eating things that were a problem for you. But once you've reached the end of that 4 to 6 weeks, you need to start challenging yourself and to see, what else can I eat that doesn't cause a problem? So choose one food with a rating of 1. Add it back to your diet. Now, you may have an immediate reaction if it's a problem, but you need to wait like 3 to 5 days to assess whether or not there's any negative effects, because a lot of reactions are delayed. So if you don't have any problems after like 3 to 5 days, and if you want to wait a week, that's fine. It's okay to add that food to your diet. Now keep in mind that quantity may be a factor as well. So maybe start with a little bit, and if you do okay, then maybe you can test and see how you do eating more. Because foods with a score of 1, people have found that they're okay in normal quantities, but maybe not quite so good at larger quantities. So you can test out the quantity feature of this as well. And again, you can probably see this can take a while, but be patient. You will end up identifying foods on this list that are not rated 0 that you can eat. And that's going to just expand your choices. So if you don't have any negative effects, you can add that food to your diet. If you do experience negative effects, it's important to wait until those negative effects resolve before you start to challenge another food. Okay, so once you've identified the foods on the score, rating of 1 list that you can eat, then move on to the foods of rated 2, and then just keep repeating this process until you've worked your way through all the foods. Obviously, the foods you want to eat. You're not going to want to eat everything on that list. There's foods you just don't like, or there's foods that that you had a pretty quick reaction to. Don't challenge those. Just leave them alone. But if you're experiencing a lot of effects, and this is just my personal opinion, that if I was experiencing a lot of effects from foods on the score with a score of 2, I wouldn't even challenge the foods with a score of 3. Or if I was experiencing a lot of effects, problems with foods with a score of 1, I probably wouldn't challenge this foods with a score of 2. So use your common sense if you're gonna do this process. And again, your body is unique and individual, and how you react may or may not be the same as the way somebody else is going to react. And again, you're working with your doctor and you're ruling out your symptoms, making sure there's not something else going on. Okay, now that we've reviewed everything, let's do a quiz and see if you can pick the right foods to eat when you're on a low histamine diet. So let's go ahead and have you choose from this list, choose the low histamine breakfast. So A is scrambled eggs and bacon. B is an egg white omelet with grated Parmesan. C is ground beef and egg yolk scramble. Or D is butter coffee made with European butter. So what do you think is the best option for a low histamine diet? The answer to this one is C, ground beef and egg yolk scramble. So let's assume the ground beef is fresh. So for me, what I do is I will defrost my meat in cold water, and then that's fine, assuming that I pull it out. It's frozen as soon as I get it from the store. So you don't want to do scrambled eggs and bacon. Again, the scrambled eggs have egg whites. Bacon is a problem. It's a 3 on the scale. Egg white and with Parmesan, both of them are a problem. And the coffee with the European cream. The European cream is is a cultured butter. So if you were to use sweet cream butter, that would be a better option. But based on this list, the best option is C, ground beef and egg yolk scramble. To the next one. All right. Next one is to choose your low histamine snack. So A would be pork rind nachos with shredded cheddar. B would be a mozzarella stick. C would be beef jerky. And D would be a hard-boiled egg. Hopefully this one's really obvious for you because we've talked about all these things. So if you chose B, you're correct. Mozzarella stick. Everything else there could have a histamine problem for you, potentially. And lastly, choose the low histamine dinner. So the options are A, aged ribeye steak with premium salted butter melted on top. B would be ham and eggs. C would be a tuna melt made with fresh blue cheese. D would be freshly caught salmon with sweet cream butter and quail eggs. Hopefully this, again, is obvious to you because of the things we've discussed. The answer would be D, freshly caught salmon with sweet cream butter and quail eggs. Hope you got 100% on all that. All right. So lastly, I just want to wrap this up, and I appreciate it if you're still here for this presentation. I know it's been kind of long, but I just want to reiterate some key points. So just want you to remember everybody's unique, so you need to pay attention to your body. How one person responds to a food is going to be different than how somebody else responds to a particular food in most cases. So really be in tune, pay attention to how you react, noting that reactions are not always short-term, immediate. They can take days. Next, the histamine food list is based on perceived effects. I know I've mentioned that so many times, but I want to make it super clear. This is people's perception of how they responded to the food. It's a large amount of people that contributed, so it's fairly reliable, but how you react may be different. Third, again, consult your doctor to rule out other causes of your symptoms. And remember what I said about ruling out. Follow up with your doctor to make sure your doctor is truly done with investigating your symptoms before you assume that the doctor is done. Fourthly, please do not self-diagnose. Don't look at the list and say, oh, I obviously have histamine intolerance, or oh, I obviously have mast cell activation syndrome. Okay, you may be right, but please do not self-diagnose. There are a myriad of other things that can cause the symptoms, and it's really important to work with your doctor and make sure that you're not missing something else. And then lastly, I didn't mention this, but I wanted to throw this in just kind of right at the end, just a little tidbit. So histamine intolerance is often temporary. So it may be that this is something you're experiencing now, but it can clear up. And then MCAS, or mast cell activation syndrome, they say is permanent. Now, of course, all of us on the carnivore diet are hoping that our conditions will clear up with the carnivore diet, and it's a matter of not being on the right diet for your body. So time will tell. We're going to see how I do over the long term. But as far as what the literature says right now, MCAS is permanent, incurable, chronic lifetime illness. So anyways, that is the end of this presentation. I hope that it was helpful for you. If you have questions or comments, don't hesitate to put a comment in the comment section below. And I appreciate you sticking around and watching this. And I hope everyone is having an absolutely wonderful day. Bye-bye.